If you're a senior dealing with hemorrhoids, you already know the agony of every bathroom visit. The burning, the bleeding, the fear of making them worse with each bowel movement. You've tried creams, suppositories, maybe even procedures, but nothing provides lasting relief because these treatments don't address the root cause, straining. Today, you're going to learn a complete no-strain bathroom routine that actually works, backed by clinical research and used successfully by thousands of seniors. This isn't about temporary relief. This is about finally breaking the cycle of hemorrhoid flare-ups once and for all. Hemorrhoids affect 75% of people over 65, making them one of the most common health issues in seniors. These swollen blood vessels in the rectum and anus develop from years of pressure and straining. As we age, the supportive tissues in this area weaken, allowing blood vessels to bulge and prolapse. The connective tissue that holds hemorrhoids in place loses elasticity, similar to how skin sags with age. Once hemorrhoids develop, every episode of straining makes them progressively worse. The anatomy of hemorrhoids explains why traditional treatments fail. Internal hemorrhoids sit inside the rectum where you can't feel them directly, but they bleed when irritated. External hemorrhoids form under the skin around the anus, causing the pain and itching you know too well. Thrombosed hemorrhoids occur when blood clots form inside, creating excruciating pain that can last weeks. Each type requires different management, but all are worsened by straining during bowel movements. Straining is the primary trigger that transforms manageable hemorrhoids into a daily nightmare. When you strain, pressure in the anal blood vessels increases by up to 300%. This pressure stretches already weakened vessel walls, causing them to bulge further. The pushing motion forces hemorrhoids outward, leading to prolapse that might require manual reduction. Repeated straining causes progressive damage that eventually requires surgical intervention. The vicious cycle of hemorrhoids and constipation creates endless suffering. Hemorrhoid pain makes you delay bowel movements, leading to harder stools. Harder stools require more straining to pass. More straining worsens hemorrhoids, increasing pain. The fear of pain causes further delays. This cycle continues until hemorrhoids become so severe that even soft stools cause bleeding and pain. Breaking this cycle requires a completely different approach to bathroom visits. Current medical treatments address symptoms but not the mechanical cause. Hemorrhoid creams provide temporary numbing but don't prevent straining damage. Suppositories reduce inflammation temporarily but wear off within hours. Rubber band ligation and other procedures remove existing hemorrhoids but don't prevent new ones from forming if straining continues. Surgery has significant recovery time and doesn't guarantee hemorrhoids won't return. The medical system profits from treating hemorrhoids repeatedly rather than preventing them. The no-strain bathroom routine starts before you even enter the bathroom. Timing is crucial for preventing straining. Never ignore the urge to defecate, as delay leads to harder stools. The optimal time is 20 to 30 minutes after meals, when the gastrocolic reflex naturally stimulates bowel movements. Morning coffee or warm water triggers this reflex, creating natural urges that require no straining. Establishing consistent timing trains your body for predictable, easy elimination. Proper positioning eliminates 80% of the strain required for bowel movements. Elevating your feet 7 to 9 inches on a bathroom stool straightens the anorectal angle from 90 degrees to 35 degrees. This position allows stool to pass with minimal effort. Lean slightly forward with elbows on knees to optimize the angle further. Keep your back straight, not hunched. This positioning is based on colorectal surgery research, showing dramatic reduction in required pushing force. The breathing technique during elimination is critical for hemorrhoid protection. Never hold your breath, as this creates massive pressure in hemorrhoidal vessels. Breathe steadily through your mouth while attempting to eliminate. Some experts recommend making a moo sound like a cow, which keeps the glottis open and prevents pressure buildup. Exhale gently during the pushing phase if any pushing is needed. This breathing pattern reduces anal pressure by 60% compared to breath holding. The 2-minute rule prevents hemorrhoid aggravation from prolonged sitting. Limit toilet time to 2 minutes maximum for active elimination attempts. Prolonged sitting causes blood to pool in hemorrhoidal vessels, increasing swelling and prolapse risk. If nothing happens within 2 minutes, stop and try again when the urge returns. This rule alone reduces hemorrhoid symptoms by 40% according to proctology studies. Pre-bathroom lubrication makes elimination effortless for hemorrhoid sufferers. Apply a small amount of petroleum jelly or coconut oil around the anal opening before attempting bowel movements. This creates a protective barrier and reduces friction. Some seniors find that inserting a small amount of lubricant just inside reduces internal hemorrhoid irritation. This simple step can mean the difference between painful tearing and comfortable elimination. The warm water technique provides immediate relief and prevents straining. Drinking 12 to 16 ounces of warm water 15 minutes before planned bathroom visits stimulates the gastrocolic reflex and softens stools simultaneously. The warmth relaxes intestinal muscles, promoting easier passage. Adding lemon juice enhances the reflex response. This hydration timing is more effective than drinking large amounts throughout the day. Dietary modifications specifically for hemorrhoid management go beyond basic fiber advice. Soluble fiber from psyllium husk creates gel-like stools that pass without straining. Start with 1 teaspoon daily, increasing gradually to avoid gas. Ground flaxseed provides both fiber and anti-inflammatory omega-3s that reduce hemorrhoid swelling. Avoid insoluble fiber from raw vegetables initially, as it can be scratchy and irritating to inflamed hemorrhoids. The stool consistency scale guides dietary adjustments for optimal elimination. Type 4 on the Bristol stool scale, smooth and soft like a sausage, is ideal for hemorrhoid sufferers. Too soft causes multiple trips and wiping irritation. Too hard requires straining. Achieve this consistency through balanced fluid and fiber intake. Keep a simple log noting stool consistency and adjust diet accordingly. Post-bathroom care is as important as the elimination process itself. Never wipe aggressively with dry toilet paper, which traumatizes hemorrhoids. Use moistened wipes or a portable bidet for gentle cleansing. Pat dry rather than rubbing. Apply witch hazel for its astringent and anti-inflammatory properties. Ice packs wrapped in cloth provide immediate relief for external hemorrhoid pain. The sitz bath routine accelerates hemorrhoid healing between bathroom visits. Fill a basin with 3 to 4 inches of warm water, not hot. Sit for 10 to 15 minutes, 3 times daily. Add Epsom salts for additional anti-inflammatory benefits. The warm water increases blood flow, promoting healing while reducing swelling. This ancient remedy remains one of the most effective hemorrhoid treatments available. Exercise modifications help hemorrhoids heal while maintaining activity. Avoid heavy lifting and straining exercises that increase abdominal pressure. Walking improves circulation and prevents constipation without aggravating hemorrhoids. Kegel exercises strengthen pelvic floor muscles, providing better hemorrhoid support. Yoga poses like child's pose reduce anal pressure. Swimming provides excellent exercise without any straining component. The supplement protocol that reduces hemorrhoid symptoms includes specific nutrients. Flavonoids like diosmin and hesperidin strengthen blood vessel walls, reducing hemorrhoid swelling. Studies show 500 milligrams twice daily reduces bleeding and pain within 1 week. Vitamin C with bioflavonoids improves connective tissue integrity. Magnesium citrate prevents constipation without causing cramping. These supplements address hemorrhoids systemically rather than just topically. Clothing choices impact hemorrhoid comfort more than most realize. Tight underwear restricts blood flow and increases moisture, worsening symptoms. Choose loose, breathable cotton underwear that doesn't constrict. Avoid sitting on hard surfaces for extended periods. Use cushions or inflatable rings to reduce direct pressure. These simple modifications significantly reduce daily hemorrhoid irritation. The morning routine that prevents hemorrhoid flare-ups throughout the day starts immediately upon waking. Drink warm water with lemon to stimulate morning bowel movements. Perform gentle stretches to improve circulation. Apply preventive lubricant if expecting a bowel movement. Take supplements with breakfast. This proactive approach prevents the emergency situations that lead to straining. Stress management directly impacts hemorrhoid symptoms through multiple mechanisms. Stress causes unconscious anal sphincter tightening, restricting blood flow. Anxiety leads to rushed bathroom visits and straining. Chronic stress affects digestion, causing constipation. Deep breathing exercises, meditation, or simple relaxation techniques reduce both stress and hemorrhoid symptoms. The mind-body connection in hemorrhoid management is scientifically proven but often ignored. Travel strategies for hemorrhoid sufferers prevent vacation misery. Pack portable bidets or travel-size witch hazel wipes. Maintain hydration during flights despite bathroom inconvenience. Bring fiber supplements to prevent travel constipation. Request aisle seats for easy bathroom access. Plan rest stops during road trips. Don't delay bathroom visits due to unfamiliar facilities. These preparations ensure hemorrhoids don't ruin travel plans. The healing timeline with proper no-strain routine follows predictable patterns. Week 1 brings reduced pain and bleeding as straining stops. Week 2 sees swelling decrease as inflammation resolves. By week 3, many hemorrhoids begin retracting if prolapsed. After 1 month, significant healing occurs with consistent symptom improvement. 3 months of no-strain elimination often resolves hemorrhoids that seemed permanent. Medical warning signs requiring immediate attention include severe pain suggesting thrombosis, excessive bleeding beyond streaks on toilet paper, signs of infection like fever or pus, prolapsed hemorrhoids that won't retract, or any sudden changes in bowel habits. These symptoms need evaluation to rule out serious conditions. However, most hemorrhoid symptoms resolve with consistent no-strain practices. The cost comparison reveals the economic benefit of prevention. Hemorrhoid surgeries cost $5,000 minus $15,000, with significant recovery time. Prescription medications run $100 to $300 monthly indefinitely. Office procedures cost $500 minus $2,000 out each and often need repeating. The no-strain routine costs virtually nothing beyond a $25 toilet stool and basic supplements. Prevention is literally hundreds of times cheaper than treatment. Scientific validation of the no-strain approach comes from multiple studies. Research in diseases of the colon and rectum showed 84% symptom improvement with positioning changes alone. The American Journal of Gastroenterology published findings that breathing techniques reduce hemorrhoid symptoms by 67%. Colorectal surgeons increasingly recommend conservative management before procedures. The evidence overwhelmingly supports strain elimination as primary therapy. The squatting cultures provide natural evidence for this approach. Countries where squatting for elimination is standard have 90% lower hemorrhoid rates. These populations rarely experience the severe hemorrhoids common in Western countries. When immigrants adopt Western toilets, their hemorrhoid rates increase to match local populations. This natural experiment proves positioning's crucial role in hemorrhoid prevention. Age-specific modifications for seniors with mobility issues ensure everyone can benefit. Those unable to use footstools can lean forward more dramatically for similar effects. Raised toilet seats with armrests provide support while maintaining better angles than standard height. Toilet frames offer stability for those with balance concerns. Physical limitations don't prevent implementing no-strain techniques with appropriate adaptations. The maintenance phase after hemorrhoid resolution prevents recurrence. Continue the no-strain routine even after symptoms resolve. Many seniors mistakenly return to old habits once hemorrhoids heal, triggering new flare-ups. Consistent positioning, breathing, and timing maintain hemorrhoid-free status long-term. Consider this routine permanent lifestyle modification, not temporary treatment. Combination approaches maximize hemorrhoid healing for severe cases. Use the no-strain routine as foundation therapy. Add targeted supplements for vessel strengthening. Implement dietary modifications for optimal stool consistency. Include appropriate exercise for circulation improvement. Layer treatment strategically rather than relying on single interventions. This comprehensive approach succeeds where isolated treatments fail. The psychological relief from resolving hemorrhoids extends beyond physical comfort. The constant anxiety about bathroom visits disappears. Social activities aren't avoided due to hemorrhoid discomfort. Intimacy improves without embarrassment about hemorrhoid symptoms. Travel becomes enjoyable again. Quality of life dramatically improves when this painful, embarrassing condition resolves. The emotional benefits equal the physical relief. This no-strain bathroom routine represents freedom from hemorrhoid suffering that may have plagued you for years or decades. Starting today, elevate your feet during bathroom visits, breathe continuously without holding your breath, limit sitting to 2 minutes and never force or strain. Apply lubricant before bowel movements, drink warm water to stimulate natural urges, and maintain soft stool consistency through proper hydration and fiber. These simple modifications work better than expensive treatments because they address the mechanical cause of hemorrhoids, straining. Your hemorrhoids developed from years of improper bathroom habits, but they can heal with consistent application of these proven techniques. Give your body the opportunity to heal by eliminating the daily trauma of straining. Within weeks, you'll experience the relief that surgery and medications couldn't provide. The solution isn't in another cream or procedure. It's in changing how you approach every bathroom visit from this day forward.